Hey, how's it going?
Hi, are you Mike?
I am, I'm Michael.
Hi, Mike. My name's John. I'm one of the students. I was wondering if you could give me the SBAR report on this patient.
Yeah, sure. I'm about to go in and get some medication real quick. I've got this is room 621. We got Mr. Lutz, Greg Lutz. He's a 67-year-old male. He's a non-smoker. He's been admitted for a stage 2 pressure ulcer on the right heel, and that's secondary to his 20-year condition of diabetes type 1.
Okay.
You okay?
So can you give me like a little more?
Yeah, I was making sure you're okay. I didn't
Yeah,
say you
I'm
were
sorry, I'm
good. Yeah, he has a history of diabetes. His most recent medical history, he had about 5 years ago a previous prostate resection that had any complications from it. Again, diabetes for 20 years. It's been controlled up until the last few weeks. He's had some real high blood sugars over 300 that's been reporting. Of course, have a pain assessment. He's in pain about a 1 out of 10 that he reported. He's alert and oriented times 3. He knows where he is and what time it is and everything. He's alert and oriented. He doesn't have any impairment in his gait or his mobility. The neuro assessment showed that he had all normal functions for his pupils. They were equally round, reactive to light and accommodation. All of his cranial nerves seem to be intact and functioning normally. And he can ambulate. He has a medium fall risk, so you want to keep an eye on him, make sure that that the call light's nearby and that there's someone checking on him frequently for toileting to make sure he's not trying to get up without assistance. So he's a medium fall risk, but he can get around. His breathing was normal. He didn't have any adventitious breath sounds or any abnormal sounds. He has no dyspnea. He's on room air, and he had a 96% oxygen saturation. His vitals, I didn't touch on this, but he did have a 98.4 as his temperature and 76 on his pulse. He had 16 on his respirations, and he had 128/70 for his blood pressure. So that all looked good. He did have some lab values that we had reported that were unusual. They were high. He has a high HbA1c, which is normal for someone who has type 1 diabetes. And we also have a calcium that's low, so you got to watch out for those electrolytes. He has low calcium, and be on the lookout for any of the signs for hypocalcemia. His fasting blood sugar was 310. The most recent count was 242. I'm sorry, we had a 242 on the most recent blood sugar. So we're definitely going to be administering some insulin for him. Some things I was going to keep my eye out for was his bun. His bun's 19. If that gets over 20, that's going to be an issue. So we got a bun of 19 to look out for. And his chloride was 104. That's real close to being high and being over the limit, so we're going to keep an eye on those things for lab values. We do have a pending metabolic profile and a CBC coming back, so we'll be looking for those results. He has some normal voiding patterns. We had a urination a while ago. We had about 320 ml, so urine, so expected urine flow. His pulses were equal and heart sounds were normal. He had a normal sinus rhythm. He was normal S1, S2. He didn't show any signs of edema or anything when we assessed him. Do you have any other questions for me? What else do you want to know?
Yeah. So, this insulin that we're giving him, why specifically is he receiving
Well,
that
he's got
medication?
diabetes, so we're trying to control his blood sugar when it gets really high. His body's not able to have normal insulin function, so we're going to give him insulin. That's going to decrease his cellular metabolic so that he doesn't. It's going to increase his cellular metabolism so that he's burning the blood sugar faster. It's also going to reduce his hepatic production or gluconeogenesis, the production of blood sugar. So we're going to try to speed up the metabolism of the blood sugar in his body, and we're going to try to prevent him from making new blood sugar with the insulin.
All right, that pretty much covers the action of the drug too, I think. So, when should you question administering this medication?
Well, if he had normal blood sugar, or if he had hypoglycemia or low blood sugar, I wouldn't give it to him because he would be a normal parameter, so I wouldn't give him anything to lower his blood sugar any further. I might cause him to be hypoglycemic about it, so every time you give him this, I'm going to be checking his blood sugar to make sure that we need to give it to him.
Okay. Which vital signs should we monitor?
I'm going to be watching pulse and respirations and for his blood sugar. We're going to keep it. Before we administer, we're going to get a blood sugar value, and then before we proceed, but we're going to be looking for again signs of hypoglycemia. He's going to have again heart rate, pulse, mental status. Keep an eye on those things.
Okay. Any other physiological parameters that we should monitor when we're giving the medication?
Yeah, I'm going to be looking for signs for anaphylaxis. You know, if someone has a reaction to it that could be life-threatening. So we're going to be looking for chills, agitation, swelling in the face, some of the classic signs for anaphylaxis, any difficulty breathing, again, back to those respirations.
Okay. What interventions must be taught to the client to make sure that the medication is administered safely in the hospital setting?
I'm going to probably make sure that this patient, when they're administering this medication, that they have been taught or can demonstrate to me the proper technique, that they use the right equipment, that they have the right size needle, they don't use any other size than an insulin needle, that and they're using a new needle each time. So I'm going to make sure that they're demonstrating to me and letting me know that they know how to use the proper technique to administer this insulin, that they're using the right equipment, and that they're testing their blood sugar frequently. They're not just taking it unnecessarily. They want to make sure they're testing their blood sugar, and make sure they're using the right equipment, the technique, that they're following nutritional guidelines, that are complementing this insulin therapy that they're on, that they're not taking insulin and going and eating ice cream. So that they're following nutritional guidelines. And blood sugar testing, and making sure that the medication itself is of good quality when they take it out. Make sure that it's clear, it doesn't have any contaminants in it, that it's not expired, and that it's the right medication. Make sure that they can demonstrate to me they know they're taking the right medication that they've been prescribed.
Okay. What are the side effects and potential adverse reactions of this medication?
The side effects for insulin, of course, this particular insulin can be hypoglycemia or low blood sugar, again, which can manifest in anxiety, restlessness, chills, confusion. I'm also going to be looking for, again, anaphylactic shock, in the patient.
Okay. And how will you know the medication is effective?
A subsequent blood sugar test. I mean, if I can look and see that their blood sugar has gone down to normal level, then I know it's been effective, and I can also see if the patient, what their condition is. I mean, are they acting normally and have normal mental status and is associated with the insulin. Yeah,
Okay.
So I guess we'll go in the room. Are you ready? Any more questions?
Oh, that sounds good.
All right. Let's pull things together real quick. Just Kurt mentioned that. Hello, sir. Hello. My name's Michael. I'm your nurse today. How are you doing? I've got a nursing student with me. He's observing today. Love us here.
To make sure it's very long.
Can you tell me your name again, sir?
Yeah, 1 second.
I wanted to make sure.
It's Glenn Light,
Thank you. What's your age or date of birth?
67 years old.
All right. We've got some orders for some insulin today. Have you taken insulin before? I know that you're diabetic for 20 years. But
I have.
have you had the regular insulin that we give? Are there any reactions to it or anything?
No reactions.
Are you you've been using this for 20 years? Do you have any questions about the medication or anything like that? I know sounds like you've been using it effectively, but had some trouble here in the last few weeks with monitoring it. Do you have any questions or anything?
Not really, just wondering why it's not working as well.
What are the side effects and potential adverse reactions?
Just a minute, look at it again real quick and make sure you're the right patient with the right medication, with the right dose, the right time, the right route.
And how will you know the medication is effective?
Hi, Mr. Davis. How are you? Great. How are you? Good. I have a level 1 too. Is that okay? Sure.
Everybody's-
Ronald Jarvis. I have your insulin for you. Where we took your insulin, and
20 units.
person had to give you injection 18. Have you taken this medication?
So where do you usually take your insulin?
Back of my
Back of the arm? You mind if I spread it around so we don't go to the same spot? There can be some adverse effects if you go to the same spot over and over again. Abdomen's okay?
That's fine.
You know, you want to spread that around a little bit, stay 2 inches from the umbilicus if you're going to do that down a little bit. Definitely want to spread those shots around.
So where would you like the injection? In my abdomen.
How are you feeling?
I'm doing okay.
You okay? Yeah, I did print out some information here for you. I noticed that you were having trouble here with that diabetic diet, so I want to make sure that you had some necessary information to read about your diet, and also about some of the signs and symptoms when you're at home. Yeah, it talks about your dietary on your 1,800 calorie diet. We also have some things to look out for here as far as the signs and symptoms if you have any adverse reactions when you're at home when you're administering this medication. And so if you take the insulin and you feel lightheaded, dizzy, or anything, you're going to want to monitor that and take precautions and call a healthcare provider if anything happens extreme.
Okay.
Do you have any questions for me?
Nope. I'm good.
All right. All right, Luce, thank you very much.
Thank you.
I've got a couple questions before you go.
All right.
So, were there any pertinent pieces of information you reviewed before administering the client medication?
Yeah, I checked his lab values, make sure his blood sugar was, it had been reported as high, so that's the first thing I would check would be his blood sugar. And I'd probably just, make a focused assessment on the patient for factors related to the insulin itself, that I'll be looking out for.
Okay. Did this information affect your decision to administer the medication?
Yeah, his blood sugar was very high, and so we were going to go forward with it and follow the orders.
Okay. And did it affect how you administer the medication too?
Yeah, after I assessed the patient and talked to him about where he was usually administering the insulin, then we're going to go to an alternative site because he seems to be using the same spot over and over. And we gave him a little bit of teaching on how to move that around and to avoid the adverse effects of lipodystrophy on the insulin site.
Okay. Thank you.
Thank you.